Well, a big change has happened that parents with young children need to be aware of. For the first time in nearly 20 years, the CDC and American Academy of Pediatrics has made changes to its developmental milestone requirements for kids.
The revisions, both groups say, are meant to give medical experts better parameters as kids grow.
Team 12's Jen Wall joins us live this morning. So, Jen, what are local experts saying about these new developments?
Yeah, good morning to you both. So both the chief medical officer here at Banner Children's at Desert and the chief science officer at Southwest Autism Research and Resource Center both say they do support these milestones as they monitor children as they grow. And they say they believe they will help create clearer benchmarks for both parents and pediatricians. That's important so teams of medical experts can identify developmental delays earlier. Some of the most noticeable milestone changes include removing ambiguous language like may or begins and adding more checklists for children at ages 15 and 30 months. That creates a milestone checklist for every checkup between 2 months to 5 years. Banner Children's chief medical officer here at Desert says the changes more clearly identify social and emotional milestones children should be meeting.
Because we know that when this group of children are identified, early interventions do help in the ability to overcome some of these developmental challenges.
Another change is now asking about milestones 75% or more of children can be expected to achieve at a certain age rather than the previous 50% of children. SARC's chief science officer says they're casting a wide net with a lot of opportunity to identify possible reasons for delays, and the revisions are based on data from peer-reviewed manuscripts and published articles.
And they were very careful to say they were going to pick milestones at certain age groups that they have documentation that says 75% of kids at this age group will be doing these kinds of behaviors. And that suggests that, that other 25% that isn't doing it should be looked at for a potential developmental delay. And that's a key element to its efficacy.
Dr. Smith says families should also trust their guts. If a parent is concerned that their child is not doing something other children at that age are, they can request an evaluation. He adds milestones need to be looked at as a whole and not in isolation. Now, coming up live here at 6:30, we talk with a Valley mom who's raising 2 children with autism. She's been through a lot of these milestone checklists, developmental delays, and she weighs in on the changes now that her children are a little older. We're live in Mesa, Jen Wall, Today in AZ.